Uh, Dr. Henry, let me start out with the first question. What time frame did it take to get up to speed from signing the contract to going live on your EHR?
Well, for me, it was a relatively long process because I helped develop the asthma and allergy-specific version of the product. We spent about 2 years on that, from when we first started working together to when I achieved 100% use. For practitioners starting with the completed specialty-specific version, the process will be much shorter. Once we had the software fully customized, it took about 3 months until all the doctors in the practice were using the system.
So I guess it depends a lot on the practice, and some people want a lot of additional customization, which does take time. However, because you've done a lot of that work for them, if they're in an asthma and allergy practice, it should be much quicker for them. The other part is people have different ways they want to implement. Sometimes they want to implement the back office first. Sometimes they want to go very slow and take baby steps. So I guess, from my perspective, what I see other doctors do, it really just depends on how you want to do it. And you can go as aggressively or as slowly as you want, and that's really the beauty of being able to go with a piece of software that's customized the way you want to do your business. One of the questions we've been asked is, does it cost anything additional to customize the templates for allergy and asthma? And what I'd just say, I'll respond to that question. It doesn't cost anything extra to use what we've already customized working with you. I'm sure most doctors will want some customization beyond that, and some of that's included in the initial proposal and purchase of the software or leasing of the software. And you can ask us to do that, or we can train you how to customize it yourself. So we have people out there today, doctors who are very technical, that do that on their own, or they have staff people that do that. But we do offer this training and skills to teach your staff how to do that. Here's another question for you, Dr. Henry, that is really, I guess, for both of us. How do I get my current patient records into an EHR? I'll start first and say there's several ways to think about that, and what I would say is that you really don't want to go back to your old records and move a bunch of data over, whether it's scanning it in or keying it in. I mean, that would be an enormous effort. So what this is going to be is, from some point forward, once you implement this, you decide to all new encounters are going to be on an EHR. What I would recommend, just based on my experience of trying to transition technology, would be maybe enter the previous 1 or 2 encounters with a patient. Obviously, you're going to have all the demographics, and then just move forward with that, and over time, let the charts atrophy. Some people do even more than that, and maybe you should share with us what you decided to do.
Well, we have been scanning in just the key data, like the lab records, the allergy skin tests, things that it's important to have on my tablet computer. We set, last year for scanning spiros, skin testing, and the other data, I've just been basically summarizing that in the new EHR so that we don't have to carry our paper records. We have everything in the tablet computer in the easy EHR.
That's excellent. So do you have a built-in billing system with this?
Yes, the Easy Suite is complete. It has both the EHR and the practice management. We've been using the Easy billing system for probably 16 years, and it integrates completely with our EHR module, as I mentioned earlier. There are 2 ways you can use it. You can use the billing as a standalone system, or you can turn on the auto billing so that your notes are sent automatically into the billing system and not reviewed by anyone but the coder. We haven't actually turned on the auto billing yet. We've been waiting until the code changes are done before we do that.
Another question just came in. How do you handle interfacing with systems and local hospitals and labs and pharmacies? And I'm going to view that initially as a technical question. And I'll just, without getting too deep into that, say that the software complies with an HL7 requirement, which is a government standard in how to communicate with other entities. And so any entity, which is very common, who uses this standard, our software can communicate with. So you should have no issues in dealing with those systems. There is a possibility that you may be in an area or have some people you deal with in local labs or organizations that don't follow those standards, and so at that point in time we could develop an interface for you to communicate with them, but generally speaking, I don't think that'll be an issue. We're getting close to the time frame that we had planned on this webinar, and I'm going to leave the time to open this to the last question, which I alluded to earlier. Can you take a moment just to kind of share your vision of the future for you and your practice?
Okay. We're not finished yet, and as I look at this, we may never be finished. My goal is continuous improvement. Soon I'll be going entirely paperless in my office. Also on the horizon is a patient portal. I want patients to be able to enter their intake data themselves online. It's easier for them and easier for us, and there will be more efficiency and less room for error. That's in the planning stage right now. There's always a way to become more efficient. And it's important for me to stress that when all this data is entered, I am the one ultimately that reviews all of it and then signs off on all of it. But if I can eliminate the amount of time I have to enter data, if someone else can enter the data and I just have to review it, again, that saves me time and it saves me money. So my vision is that this is a work in progress. I am very pleased with the way the systems come together, but there are things that I see that could even make my practice more efficient.
It sounds to me like that implementing EHRs help you get more control of your practice. And the patient portal thing, I think that there's many consumers today and patients in the marketplace who are used to using technology, and giving them the opportunity to update insurance information, address information, contact information, request an appointment or a prescription or pay a bill. We're all so busy these days. To be able to do that when you're sitting at home and logging on to your website, I think that is an awesome thing to do, and I look forward to hearing how using our technology, your practice feels it really helps you out and helps your patients out and makes everybody happier in doing business with you.
And again, it makes it not only more efficient but more profitable. And right now, as everyone knows in healthcare, if you can't be profitable, we're going to die.
Yeah, that's definitely the truth. I really appreciate your time, Dr. Henry. I appreciate your working with us and your partnership, and I really appreciate you as a customer, and look forward to additional communications in the future. Thank you very much.
Well, thank you, Rick. Okay, bye-bye.
Bye-bye.